Good morning, everyone. Lots going on. And right now, masks are a hot button issue. Should you wear a cloth mask when you go out to the grocery store, or an N95 respirator, or no mask at all? It's up in the air, but not really. Not really. Because it's undisputed that N95 masks are in high demand for medical workers. And if it stands to reason that masks protect medical workers or give medical workers a higher level of protection, then you would also be protected. And not to say that you should get out there and take all the N95 masks, darn the healthcare workers, right? I've got mine type deal. I'm not saying that by any stretch of the imagination, but masks help. Masks help by filtering out particles that you inhale, potentially, right, when you're out in public. But masks also help to contain particles that you put out when you sneeze or cough, or even when you talk, right? Sometimes I look at my spit shield after my show. Actually, more often I look at my microphone after singing, and I'm surprised with how much stuff is on there. It's kind of gross. I wouldn't go to an open mic during COVID-19, right? But that's just the nature of singing, and that's the nature of talking. And if you have a cover over your mouth, it cuts down on that kind of stuff. That means that the potential for you to pick up maybe a box of something off the grocery store shelf that somebody has maybe touched their face and then touched the box and then thought, no, I don't want that, and they put that back. And then potentially that could spread the virus. And I mean, is that a long shot? I'm not sure. I don't know. I don't know how infectious this thing is. I don't think anybody does. But that's potentially how things do get spread, right? You cough on your hand a little bit, you put that on the keyboard, somebody comes in to enter a password or show you something, and then they eat a muffin and, they've got the same flu. Terrible, awful. But human, right? It is what it is. But Canada has been widely saying, don't bother wearing a mask. Our health officials are saying, the public health officer, Dr. Theresa Tam, Patty Hajdu, who is just a Lakehead University graduate with a Master of Public Administration, from the University of Victoria. She's got a Bachelor of Arts. She's very underqualified for this. Anyway, we'll talk about Ms. Hajdu in a minute. But here's Dr. Tam saying, wearing a mask for non-infected individuals is not necessary. And this is only a few days ago, 5 days ago, when they knew very clearly that asymptomatic spread is something that happens. The WHO was clear on this in February. Okay, here we go. Here's Dr. Tam saying, don't bother wearing a mask if you're not infected with COVID-19.
Putting a mask on a asymptomatic person is not beneficial, obviously, if you're not infected. If you're a close contact of a case, and under certain circumstances, especially, you'll also be in self-isolation, by the way, if you're a close contact of a case.
So what she's saying there is you wouldn't be going out, right? If you were infected, or if you were potentially exposed to infection, you wouldn't be going out. But at the same time, she's not talking about the potential for, any one of the people on a plane who was infected on the plane and unknown, had 5 days of no symptoms and was shedding virus. Those people wouldn't have any indication that they were not sick. So putting a cover over their face to prevent their droplets from getting on everything they touch would be potentially good, right? Like if you put something over your face and then you can't touch your face because, there's a mask there, that's going to be helpful, because then you're not spreading your germs all over the place. Here's Ms. Hajdu saying the same thing. We don't need to wear masks. This is published on April 1. We knew clearly asymptomatic people were spreading this. We know clearly this is droplet and aerosolized. We know clearly we need to cut down on people's touching their face and then touching things like keyboards or boxes, bread bags at grocery stores, that kind of stuff, right? If we're taking this seriously, then then it would be as common sense as stopping the flights from infected areas. So yeah, let's just continue. The article says, until recently, the federal government was saying that masks are unnecessary for those not exhibiting COVID-19 symptoms, and that non-medical masks or poorly fitted medical masks won't filter out the small airborne particles carrying the virus. And in fact, they don't just say don't wear a mask. They say it increases your potential for getting infected because you have to touch your face to take the mask off. Yeah.
I think, first of all, the premise that the science is clear is not accurate, but I think there are obviously growing thoughts around the use of masks for general.
These are people who believe that the science is clear on global warming. Okay, it is jaw-dropping because of their willful ignorance or their cherry picking of whatever data they want to make true whatever they want. It's offensive to anybody thinking. Really, seriously, you can make any scientific thing say anything you want. I mean, the person writing the scientific papers on airports and border control was Dr. Tam. from the 2003 SARS event. So she's citing herself. It makes no sense because now, what are they suggesting? Hold on, here it is. Right? Patty Hajdu, the virus is 10,000 kilometers away in China. There's no point in closing the borders. This virus knows no borders. Virus spreading in Canada. 2-meter border around you will stop the virus. Yeah. And we had to close our borders to the United States. I mean, just the stuff that they're saying is just wrong. And I mean, she's got a BA in public. What did I say? She's got a BA in a Bachelor of Arts in Master of Public Administration. A Master of Public Administration. I mean, this is offensive.
Public wearing. Certainly, Dr. Tam's been keeping her eye on that science and giving us advice in terms of our own messaging. But yes, it's absolutely critical that if people are wearing masks outside, and it certainly is their prerogative to do that, by the way, that we're not taking away masks that are surgical or specialized that are extremely necessary on the front line, and that we're not using masks in a way also that are not appropriate. So, for example, most people don't realize, most general public doesn't realize that N95 masks just put on don't necessarily provide a greater level of protection. They have to be fit tested, which is a long process that I won't describe right now.
But I will, because I wear not a 3M mask, an N95 mask when I go grocery shopping. You know what fit testing is? You pinch it over your nose and then you make sure it's fitted over your face and you don't touch it, and then you inhale. And if the inhalation brings the mask closer to your face, like it's kind of suctioned to your face, then it's fitted correctly. And she's basically saying if you don't follow the manufacturer's instructions, it's not very useful. But if you do follow the manufacturer's instructions, it is very useful because it prevents you from inhaling other people's droplets and you from touching your nose and your face. And it's just offensive that this is on April 1st and they're talking all about how, oh, well, you don't really need to. It's not really a big deal.
But ultimately, at the end of the day, an N95 doesn't provide you additional protection if you're not using it properly. Dr. Tam is
frustrating. And then this happened, right? If you can try and take Trump down, forget about that mask thing. 3M says Trump officials have told it to stop sending face masks to Canada. Trudeau responds. Here's the socially awkward penguin. Masks don't work. Trump took our masks. Socially awkward, socially cool penguin. So this is funny. It's funny because the disinformation is just horrific, awful. Because, I mean, there are people, if they're recommending face masks for public or health workers, for anybody working in a hospital, does it not stand to reason that a mask would help you too in the public? Like it would add some protection. And it's not just me saying that. It is certainly, well, we'll go through this and then I'll show you the rest of the articles. This is April 3rd, a few days later. Should we all wear masks to slow COVID-19? Some experts are shifting their advice. Shocking, right? Here's the WHO's own 2019 report on pandemic recommendations. I'll read that. I'll show you that in just a second. But I want to show you, if you can take down Trump, man, don't worry about it. This is the level of intelligence they believe the Canadian public has, right? You don't need masks, but they're taking our masks. Here you go. A battle is shaping up between Donald Trump's White House and one of the world's largest manufacturers of protective medical gear and Canada's supply of surgical masks. A mission-critical tool in the fight against COVID-19 is hanging in the balance. Mission critical now, right? Oh, you don't need a mask. Minnesota-based 3M says the Trump administration is trying to prevent it from exporting N95 respirators, the high-grade face masks that are in high demand and dwindling supply around the world as health professionals and now members of the North American public try to defend themselves against the novel coronavirus. I scroll down. The company was singled out for criticism Thursday by President Donald Trump, who has invoked the U.S. Defense Production Act to compel 3M to prioritize orders from the Federal Emergency Management Agency for masks to help meet soaring American demand. Quote, "We hit 3M hard today after seeing what they were doing with their masks," Trump tweeted. P-Act all the way. Big surprise to many in government as to what they were doing. We'll have a big price to pay. And so that's the Defense Production Act. Okay? And I mean, just to put it in context, if Canada had a shortage of PPE, if Canada needed PPE and it had factories that were making PPE, but the factories were exporting those supplies to another country, any other country, would that be acceptable? No. It's when your country has enough that it's okay to export, right? And in this situation, there are tools at the disposal of the United States there you go, that were written in the 1950s, I believe, to make sure that they could take care of themselves. Taking care of yourself as a country is not a bad thing. And it's weird that we've been led to believe that it's a bad thing, right? It's very, very strange, right? Back to this. Demand for so-called personal protective equipment, gloves, gowns, face shields, and all the all-important N95 mask have been soaring around the world as overtaxed doctors, nurses, and hospitals struggle to manage the spike in COVID-19 cases while protecting themselves from infection. Yeah, I haven't seen that. I've seen a couple of places like Italy, like Wuhan, kind of, places in Iran, but I haven't seen like. Our hospitals have had time, like the police went the other day and had their cruisers all parked outside and did a big clap to the hospital people. I've seen Twitter posts saying the hospital people say thank you very much, but please stop sending food to like the citizens of Guelph who are trying to virtue signal by sending food to places. Look what I did, right? I mean, it's a nice act, but it's just a weird thing. It's like buying a Prius because you want to help the environment, right? Like do some research. It's just weird, right? But the other day as well, I saw a picture out in front of our local hospital with all of the medical staff or whoever was working that day, I suppose, in face masks, all kind of like collected up for a picture. And I was like, well, that's irresponsible. Like either it's happening or it's not. What are all the patients doing if you guys are out standing on in front of the hospital taking pictures with each other, right? So I haven't seen this demand. I haven't seen this demand for the protective equipment. And like maybe there is, and I've seen news articles talking about rationing of PPE in Canada. And I've seen news articles talking about Justin Trudeau sending all of our PPP out of Canada as well. And I've talked about all of those things. But I'm specifically talking about the patient crunch and the time it takes to get everybody organized to go stand out in front of the hospital, right? Like, what are you doing with the patients if there's like this everything to do all the time? It seems like it's a PR stunt. Patty Hajdu, Master of Public Administration. So should we all wear masks to slow COVID-19? Some experts are changing their tune. With PPE, this is a Toronto Star article published, I should have said it at the top, published on April 3rd. That's yesterday, today's the 4th. With personal protective equipment, PPE, in short supply in many countries, including Canada, there's broad and powerful consensus among officials about the need to reserve medical-grade masks, including surgical masks and tight-fitting N95 respirators used in hospitals for healthcare workers on the front lines of the pandemic. Unlike N95 masks, which contain a filter to protect the wearer, the growing Masks for All movement sees cloth masks as a means of protecting everyone else, a barrier, however imperfect, to catching infectious droplets from sneezes, coughs, and exhalations. This position is gaining steam with emerging evidence about COVID-19 that suggests the virus may travel farther through the air than previously thought. This has been accepted by the WHO in mid-February, and people were talking about this then. It's irresponsible that the Canadian media is just catching up now. Back to this. Thursday marked a break between officials in Canada and the U.S. on the issue, at least for the moment. After initially saying universal mask wearing isn't needed, U.S. President Donald Trump said he was planning to release new guidelines urging all Americans to don face coverings in public based on forthcoming recommendations from the Centers for Disease Control. Then, late Friday afternoon at his White House briefing, Trump said the Center for Disease Control recommended that Americans use basic non-medical cloth masks on a voluntary basis, the New York Times reported. You can do it. You don't have to do it. I'm choosing not to do it, Trump said. It's only a recommendation. This is the Edmonton Journal, and this is looking at Canada's bumbling response to COVID-19 is already snafu, but is FUBAR next, right? You know what FUBAR stands for, right? Effed up beyond belief. Okay, so during a pandemic or epidemic of any severity, hand hygiene, respiratory etiquette, face masks for symptomatic individuals, surface and object cleaning, increased ventilation, isolation of sick individuals, travel advice. In a moderate pandemic or epidemic, all of the above, plus avoiding crowding, right? That's for both. In a high pandemic or epidemic, all of the above, and face masks for public, and that's on epidemic and pandemic, school measures and closures, right? We're at that level. So why is Canada's advice against what the WHO issued last year in 2019? It seems really strange. Really strange. Not recommended in any circumstances, UV light. Oh, okay, interesting. I was going to make a UV box to put my Amazon products through. I was going to have like a UV, like put your deliveries here and just put the UV on top and like a mailbox, right? I'm just lazy. I just haven't got there yet. I don't have time. It's crazy. Maybe I'll buy it. Maybe that'll be a product people want. Anybody want a UV mailbox? Okay, let me know. Okay, Halton police are tweeting, we understand it can cause distress to see someone sneeze right now, but that is not an appropriate reason to call 911. That's a real tweet. That's a real tweet, okay? Please don't call 911 for sneezes. Call 911 on your neighbors for being in the park. Unironically, that's Canada right now. Here's Doug Ford saying that this is bad, really, really, really bad. How bad? COVID-19 could kill 3,000 to 15,000 people in Ontario, provincial modeling shows. I believe that was just for the month of April, over the course of the coronavirus pandemic. That seems low. Honestly, that seems low. The flu, I think the comparison was the flu at 1,500 people for a year. Yeah, okay. That's okay. He said about 1,300 people, 1,350 people die of the normal seasonal flu. In a bad year, 1,500 people die. And then, so they're saying 3,000 to 15,000. I mean, that is a significant increase over the flu. But from what I've seen with images from China and Italy, that still seems like a slightly, he's choking the bat a little bit on that one, right? I don't think he's telling us the whole projection, really. And I still think this government's response has been irresponsible and just not nearly enough. Not nearly enough. It's been absolutely incompetent. It's what you would expect of a minister whose educational achievement is a master of public administration, who is trying to be a health minister, right? I mean, it's the wrong person for the wrong job at the wrong time. And why does this government continue to listen to this person's erroneous advice, like just awful advice? Don't wear masks. It's fine. We don't need to wear masks. Liberals' agenda put on shelf by COVID-19. Thank goodness. Thank goodness. As a new year dawned, the government's throne speech commitments unfurled just weeks earlier were grabbing headlines and galvanizing the attention of federal policymakers. Then came the most serious public health crisis in recent memory. The Trudeau government's planned gun control measures, assisted dying legislation. Hold on a second. Are those the same legislation? We're going to use this gun here to help with the assisted dying legislation. Just sit there for a second. Okay, this will take, you won't even notice. Right? And efforts to advance reconciliation with Indigenous peoples are taking a back seat. At least, I wonder, these gun control measures could really take care of both of these things, right? If you were creative. At least for now, to the all-consuming fight to help people weather COVID-19. That was tongue-in-cheek, everybody. I'm not suggesting using guns on Native people. I'm saying that all of these things, I'm glad are not happening, because this government has bumbled and bungled every single one. Every one. And all of this stuff is not at all what the public was expecting, and not what the Indigenous people here were expecting either. And I don't think any of their initiatives have been met with a positive response. And so I'm glad that these are all shelved. I'm glad that they're not happening. It's ridiculous. Even the federal budget, a fixture of the late winter parliamentary agenda, has been delayed indefinitely as the virus monopolizes time and resources. So I said when Morneau came out in early March, and he said the budget will be unveiled on March 30th or 31st. And I said, that's not going to happen. That is definitely not happening. And it didn't happen because of this. And, this is a big deal. And not to say that I'm glad this is happening. I'm not. But I'm glad that these policy agenda items aren't being pushed through, because they're being pushed through on false premises. And I don't know that our opposition has the strength to oppose any of them. And I don't know that the Indigenous people will have any. Trudeau talks a lot of game, talking about how that's an important aspect. But I often talk about how actions matter more than words, right? Like, what you do matters a lot more than what you say. And what Justin Trudeau has done and his Liberal government has done is pretty much nothing, right? Pretty much nothing. So why believe them? They've given us absolutely no reason to be confident in any of the things that they're doing. Nothing, right? Nothing. So why believe them? Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co, and have a wonderful, wonderful day. Wash your hands.